right, well, thank you everybody for joining us. We're really excited to talk today about a recent study about the spread or lack thereof of COVID in childcare. And Walter will characterize this how he likes, but I mean, one of the things that's important about this is it's with a very specific focus on our early care workforce and their perspectives and their experiences. And so we always keep this sort of informal. And so what I will do is I will introduce Dr. Gilliam, our guest speaker, and then we'll also hear just a minute after a reaction from Elliot Brenner from Klingenstein Philanthropies, who is one of several funders of the study, but he'll bring the funder perspective. And then we generally keep this pretty informal. So I imagine that this is a topic that a lot of folks have been thinking about and that we'll have pretty robust discussion. I will say Walter and I had an opportunity to talk about the study a few weeks before it came out. And so we were only talking about the methodology. We weren't even talking about the results yet. And as a person who has sort of been involved, not as a researcher, but as a policymaker, partnering with researchers for many years, there was enough to talk about the methodology and the potential and the qualitative possibilities that, I mean, we could have talked, I think, for a whole day just on that. Not even, the results were still embargoed. So I think that you'll find this a really juicy conversation. So by way of formal introduction, I'd like to introduce Dr. Walter Gilliam, Professor of Child Psychology and Child Psychiatry at the Yale Child Study Center and the director of the Edward Ziegler Center in Child Development and Social Policy at Yale University. Walter, why don't you just launch in however you would like.
Great. Thank you so much. It's so great to see you, Shannon, and it's so great to see everyone else, Elliot, Andy, everybody else. Thank you so much for inviting me here to speak to you at the Early Childhood Funders Collaborative. So I was asked to talk a little bit about basically the idea behind the study, why we did the study, how we got the funding, the methodology findings. And I read through all of the things that I was asked to talk about. And I wanted to make sure that I got everything. So I did make one PowerPoint slide. So I'm going to apologize on the one hand that you're going to have to look at a PowerPoint, and on the other hand, offer you the fact that it's just one slide. and so I did bring that here, and I'm hoping I got up. Yes, it looks like I can do a share screen, and I'm going to pull up the slide. Can everybody see the slide right now? I can't hear anybody. Is this visible?
Yes.
Yes, we can.
Great, super. So I'm not going to be able to see you for a while, so hopefully you'll be able to see and hear me. So in terms of why we conducted the study, so as we all know, at the beginning of the pandemic, there was a massive amount of uncertainty about exactly how COVID-19 might behave in childcare programs and in schools, and whether or not childcare programs and schools would be a place where there would be maybe rapid spread of COVID-19. There was certainly a lot of research to suggest that would be the case, and there's quite a few people who have done some really highly detailed research on the spread of influenza and other types of things like that in schools and childcare programs. And people write this stuff up in science articles with language as colorful as super spreader and hotbed of infection. And so the worry basically was that perhaps if COVID-19 found its way into a childcare program, it would get passed around really fast, and then it would spread back out as children and staff go back home. And so when you think about the virus, I mean, it's kind of like thinking about air travel. If the virus can get to an airport hub city, it could fly from there anywhere. And so that was the concern at the time. So there was a public health concern behind the study, and there was also just the fact that this is a threat to children, and it's a threat or a potential threat to caregivers. And much of the research that I've done in the past was about threats, whether it's economic threats to childcare and childcare providers and children, or whether it's the threat of racism and bias, or whatever it is that threatens children in childcare. That's something that's of interest to me. And so And so I wanted to do it for that reason too, but also because, it's an opportunity to raise up the voices of the field, because there's no way to be able to do a study like this without getting the information from the field. They're the only ones who could tell us whether or not they've ever tested positive for COVID-19 or been hospitalized for COVID-19. So the idea of this was kind of going back to a lot of the work that we do at the Edward Ziegler Center in Child Development and Social Policy. How do you take what you see happening in practice and turn that into important research that can be done? And then how do you move that into policy, hopefully so that we can change the rules by which practice operates so that it can then feed back to practice change. But this, to some degree, took on a different flavor in that it was also rapid response research, because we didn't really have a lot of time to plan this out. Typically in a research study, people take months, if not years, to plan out a study. Months, if not years, to get the funding secured, and then months, if not years, to actually do the study. But in this case, we didn't have months, if not years. And we had to do this really fast. And if there was ever any regret that I had in terms of how we did the study, it was coming up with the idea a little too late. I wish I'd come up with the idea sooner so that we could have been more thoughtful in how we did it and not have to scramble so fast. The schools shut down in March, around March 13, 15, in different states. And many childcare programs shut down at about that time. When literally every single nation in the world shut down its public schools, affecting 90-some% of all the world's school children. In childcare, not quite so much, but still quite a few, and so, this was certainly a rapidly evolving threat. And at the very beginning of the pandemic, I, like many other people, were spending my time mostly trying to figure out, how do we give guidance to the childcare programs that are struggling through this, the childcare programs that are deciding to close, as well as the childcare programs that are deciding to stay open. And I wish that we would have had more guidance at a federal level. But for all the reasons that I'm sure many of us would be able to cite, we did not. And it took forever to get anything even from the CDC. And it took a long time to get much of a statement from the AAP. And so, there really wasn't a whole lot of guidance that was out there. And so I, like many other people, spent the first couple of months scrambling with that. And then around May, I decided that if we're going to get anywhere, we need to try to get information that's sort of ahead of the curve on this, and that the real question that's going to eventually come up is, how do you know when it's safe to get back into the water, and under what conditions might it be safe to get back into the water? And of course, a question like that begs an even more foundational question of whether it was ever unsafe to begin with, and how unsafe, under what conditions, under what conditions inside the program, and also under what conditions in terms of the greater community. And so around the beginning to the middle of May, I started conceptualizing what a study like this might look like. And in a way, it's kind of like a natural experiment. But in this natural experiment, the experimental condition isn't the virus itself. The experimental condition is the decision that some programs had to stay open, and some programs had to stay closed in the middle of the pandemic. And because some stayed open and some stayed closed, that meant that some childcare providers were coming into regular contact with childcare and children in childcare, and some childcare providers were not. And so if we could control for enough background factors that had to do with the likelihood that somebody would come into contact with COVID-19, and background factors having to do with other types of things that they might be doing in their private life to reduce risk, or things that might increase risk. And if we could statistically control for that and isolate down the main difference being some providers being exposed to childcare and some providers not being exposed to childcare, then maybe we could actually answer this question. But it was a really shrinking window, because by the middle of May, it became clear that around the beginning of June or so, a lot of child care programs were starting to reopen in a lot of states. And so we had this moment that provided us an opportunity, but we had to act on it really super fast. And so literally I was throwing together the protocols, and the team was working on creating the data collection efforts, and I put together a team of epidemiologists and infectious disease control docs. I mean, one of the great things about working at a university is all the world's great experts are literally just down the hall, except in a pandemic, of course. They're not down the hall, but they are in your university Rolodex, and they would be just down the hall if they were in our offices. And so I was able to contact a lot of folks that could be incredibly helpful to this. One of our collaborators on this works with the World Health Organization and is chairing the committee on vaccine safety protocols for COVID-19. So he's a big deal, and we have several other epidemiologists who really work on this a lot, and another pediatric infectious disease control doc who is part of the research study group, who is in charge of pediatric infectious disease control for Yale Children's Hospital. And his area of work mostly is how do you control and mitigate infectious disease spread in programs and settings that serve children. And in particular, he was interested in respiratory disorders and the spread of respiratory disorders in children. So I think that's perfectly ideal. And so we pulled together this team really fast. While we were pulling together the team and trying to figure out what the protocol is, also trying to figure out, how could we be able to find enough childcare providers to be able to do a study like this. And I'll tell you more about that in a minute. And it was clear that we would need to compensate or at least offer something for people to be able to participate in something like this, because it wouldn't be just a couple of questions. We'd have to ask a lot of questions in order to be able to get the information that we would need to do something like this. And so I just being perfectly frank among friends, I contacted a lot of folks in foundations that I knew, and asked them and told them the urgency of it and the fact that we had a really shrinking window, and if they could do this, that's great, and if they can't, I fully understand. And then also just being perfectly frank, while we were trying to find out whether or not we could get the funding for it, we kept plowing ahead as if we were going to get the funding, because we just didn't know, and so I was ready to take out a loan if necessary. And be able to raise the money some other way if necessary, to be able to pay and compensate these childcare providers. But fortunately, a lot of our colleagues were able to operate really fast and offer some support. And the first was the Andrew and Julie Klingenstein Family Fund, and also the Esther A. and Joseph Klingenstein Fund. And Elliot here is on this Zoom broadcast, as well as Andy. And they were incredibly gracious in taking a chance on a study that looked like it was being thrown together incredibly fast, which it was. And a big chance on something that wasn't fully thought out, which also is true. But we had urgency. We also did have some background in doing this kind of research, and so we were able to draw upon that. And I can't express enough how grateful I am that they were willing to take this kind of a chance. And the Heising-Simons Foundation then offered resources and provided resources. The W.K. Kellogg Foundation, Foundation for Child Development, Early Educators Collaborative, all of these groups eventually over time were able to offer support, and then that allowed us to be able to provide the compensations, to be able to hire statistical assistants, to be able to pay postdocs working on this, to be able to hire students to do some rather extensive coding of qualitative information, and I can tell you more about in a minute. And then also Scholastic, as in Clifford the Big Red Dog and Harry Potter, they already fund me to do policy work. And so we were able to draw upon some of those researchers in the Yale Institute for Global Health and the Yale Tobin Institute for Economic Policy. Some of the collaborators worked there, and they were able to bring in institutional resources to be able to conduct some of the work that needed to be done for this. So in terms of the methodology, I put in parentheses with a little help from my friends, and that's actually quite a understatement, and please forgive the Ringo Starr quote on that. So the methodology was kind of complex for something like this, and I'm not an epidemiologist. I'm somebody who studies childcare and childcare policy and early childhood policy and things like that. But I can find epidemiologists and I can find infectious disease control docs. And so when we brought them in, one of the things that was really clear was that we can't really do a study like this unless you have a lot of sample. And the reason that we would need to have a lot of samples, at the time that we were collecting the data, only about 0.8% of the US adult population was screening positive for COVID-19. And so if you needed to find hundreds of childcare providers who actually contracted COVID-19, and you had to have a data set big enough to be able to have some that actually contracted it, in order to get hundreds that contracted it, we would need tens of thousands in order to find those hundreds, you know. And so it was clear that we would need to have a large sample. And so we ended up with a sample of 82,000, of which 57,335 gave us the full amount of data that we needed in order to be able to conduct the study. You know, so there is a bigger sample that we can use for some other studies, but in terms of all the information that we needed for this, it was 57,335. And that was 57,335, depending on how you define childcare worker, is somewhere between 5 and 11% of the childcare workforce, you know, depending on whether or not you use estimates from organizations that have a lot of knowledge of childcare, or if you rely on the American Communities Survey estimates. You know, so the dispersion of those childcare providers that were in the study, all 50 states, Puerto Rico, DC, there's 3,100 plus counties in the United States. 71% of those counties are represented here, which was important because we needed childcare providers in high infection counties and middle infection counties and low infection counties in order to be able to statistically control for the amount of COVID in their community. We surveyed these providers and asked them a ton of questions. And most of it was about demographic factors that might put them at increased risk. But we also asked them about what they do in their home life to try to mitigate the spread of COVID-19 to themselves and to their families, like where they wear masks when they went to the grocery store, were they socially distancing, washing hands frequently, but also things like where you finding yourself canceling family vacations, where you're finding yourself not going to certain events that you would normally go to because the numbers of people over there. Because we needed to also statistically control for other ways that they could get infected, which was like out in the community. We asked them a lot of questions about what kinds of things they were doing within their program to try to control the spread of COVID-19. And we also asked them about whether they had ever had COVID-19. We asked them about individual symptoms, symptom clusters, and then beyond that, we asked them if they've ever been tested for COVID-19. Have you ever had a positive test for COVID-19? We asked them whether they'd ever been hospitalized for COVID-19 with a diagnosis of COVID-19. We asked them these questions also about household members so that we could then look at, you know, sort of rudimentary contact tracing, you know, in terms of, you know, whether it was likely that they got it from a household member, they might have given it to a household member, and we do that by dating the onset of symptoms. You know, so as you can tell from this, I mean, it's a lot of questions, and it took a lot of time for them to be able to answer all of this. We asked them questions about how much contact they had with childcare, whether their program closed at the beginning of the pandemic, whether it reopened, whether it stayed open. If it was open, did they come to work, or did they mostly stay at home? Were they maybe laid off? Were they maybe providing some kind of distance online support to the program and not coming into contact with children? We needed this in order to be able to separate out those who had contact with children in childcare from those childcare providers who didn't. And then when we got all the data from this, I should also say lots of other types of information too, including depression screeners, stress screeners, all kinds of different things, so that we could then look at other stuff later on down the road. Once we got all of this information from them, and we were able to then geolocate where their childcare program is and identified where they lived in terms of which county, we were then able to then access all of the COVID-19 data from Johns Hopkins University in terms of spread, and then merge their data set in with our data set so that we can then, look at these relationships that we were needing to look at within the context of how much COVID-19 was in the community. I mean, it's one thing to be a closed childcare program because of COVID-19 in the middle of the Bronx, but you can't compare that to what happens in an open program that happens to be in rural Montana in the first 3 months of COVID-19, and perhaps in a county where no COVID-19 has even been found yet at that time. And so we needed to know, where they were located so that we can look at the amount of COVID-19 that was going on in their county. And so our proxy for that was COVID-19 deaths in that county divided by the number of inhabitants of that county. So rate per thousand of COVID-19 deaths. We didn't go with testing data, and the reason why was because testing was just so incredibly spotty in terms of its access and its reliability at that time. So we went with deaths as a more reliable estimate according to our epidemiologists that were on the team. So the methodology basically was comparing these two groups, those who came into large amounts of contact with children in child care and those who came into virtually zero amounts of contact with children. And it just so happened that at that time, about half the sample was working and coming into regular contact, and about half the sample was not. So I mean, it was absolutely perfect for this kind of an analysis. I'm not so sure that that would have been the case had we waited even a few more weeks after that. We collected the data between May 22nd and June 8th. That's when we collected the data, and then lots of data cleaning that was necessary for that, and lots of work in terms of merging data sets and things. So the findings basically was that when you statistically control for all these other background factors that might be related to it, there was no difference between those who went to care on a regular basis versus those who didn't in terms of their rates of actually reporting having COVID-19 or being hospitalized with a COVID-19 diagnosis. We wanted to make sure that we were really getting robust findings here, that they were replicable and we weren't missing something. So we literally analyzed the data in two completely different directions. One was with the full data set, looking at the relationship between whether you were open or not to how likely it was that you were going to get COVID-19. And then we did something called a case control methodology, which literally is in the opposite direction. We looked at individual cases of COVID-19, and 427 of our child care providers out of 57,000 plus did report having COVID-19. So we found those 427 and then had the statistical program randomly select matches for them, basically doppelgangers, from the data set who were demographically identical to them. Demographically identical in terms of them as a person, in terms of the types of programs that they were in, and also identical in terms of similar amounts of rates of COVID-19. And then work it backwards to see whether or not, whether you were testing positive for COVID-19 was related to whether or not you were coming into contact with child care programs. And so in both cases, we found no differences. Now, that doesn't mean that people don't get sick. Certainly, I said before, 427 of the child care providers did get sick. So we can't really say that child care providers are magically immune to COVID. I will say that child care providers are magical. They are magical people who work in magical places, but unfortunately they're not magically immune. They can get sick, but it just, the data that we got and the findings that we were getting from this suggest that whatever they were getting sick from, it wasn't something that the child care program or being exposed to child care was contributing to. It was other types of community factors. We also found that our Black, Brown, and Indigenous providers were statistically more likely to get COVID-19. And that's a replicated finding on just by anybody who's doing COVID-19 research, that our communities of color carry a heavier burden of COVID-19. But even for them, when we analyzed for interaction effects and when we analyzed the data specifically within racial groups, even for them, it had no relationship to whether or not they were coming into contact with child care or whether they weren't coming into contact. In other words, our Black, Brown, and Indigenous providers were more likely to get sick, but for community factors that appeared to be totally unrelated to access and exposure to child care. That's an important point because, one, it raises the equity issue, but also it also raises the issue that oftentimes in research, when we conduct research, we lump a lot of people together, and then we say something that's true on average, but when policy could be made about something, or when information could be consumed by the public to be able to make personal decisions, I think there's a higher burden than just talking about how do people behave or how do outcomes work on average. If we had said that on average, it doesn't seem that child care programs increase the risk of COVID-19, but that's not true for Black providers, or if that weren't also true for Brown providers or Indigenous providers, then ultimately we could be sending a message that on average might be true, but might put individual groups in harm's way. And so we wanted to be incredibly safe with this and make sure that we were looking at this data sliced up in every way that we could possibly imagine. Same thing for home-based versus center-based providers. In our analyses in this direction, the case control analysis, home-based providers had an increased likelihood of COVID-19. But even for home-based providers, that increased likelihood was due to community factors that were unrelated to whether their program was open or closed during the first few months of the pandemic. So even in that case, we wanted to make sure that we were finding it. I think some of the caveats that have to be remembered in this study was, one, these childcare providers were doing a lot to keep children safe. We're talking about 3/4 of them were doing daily screenings and temperature checks on every adult and child who came into the program. And about 1/3 of them were doing that twice a day or more. We had 90-some% of our childcare providers reported doing at least once a day, disinfecting literally every surface and fixture, and over half of them reporting doing that 3 or more times a day. 90-some% frequent hand washing of the staff, frequent hand washing of the children. Tom Murray, our pediatric infectious disease doc on the team, said, 90-some% compliance with frequent hand washing, that's what we look for in the hospital. So I really can't say enough about the fact that these childcare providers, and there's a whole host of other things too that they were doing, like cohorting and on, and curbside pickup. There's a whole host of things that they were doing to keep children safe. And so we can't take the findings that we have from this and say, well, that means that childcare programs don't seem to contribute to spread in general. Because the reality is childcare programs didn't seem to contribute to the spread of COVID-19 doing all the things that they were doing. And if we were to stop doing that, there's no way to know that those findings would still hold. The other important finding in this too is just on the basis of the way in which studies like this are conducted and the way in which the analyses are conducted, the only thing that you're able to look for is added risk. I can't say anything about risk from programs. I can only say about risk of programs within the communities in which they exist. And so the findings basically say that childcare programs don't seem to increase the risk, but that doesn't mean that there's no risk at all. It just means that childcare programs don't seem to be a main driver above and beyond just what happens within communities. That doesn't mean that COVID can't spread in a childcare program. Obviously it can. It's just that childcare programs don't contribute to the risk above and beyond just even staying at home in your community, and going out even rarely. And so one way to think about this is that, based on the findings that we had, childcare programs do not seem to pose a significant threat to communities in terms of the spread of COVID-19. But that doesn't mean that communities can't pose a threat to childcare. And indeed, communities with high levels of COVID-19 were also more likely to have childcare providers get sick. And so one of the things that we need to be aware of is that if we want to keep childcare programs safe, we have to do the right thing in our communities. If you want to keep childcare programs open, wear a mask when you go to the grocery store. If you want to keep childcare programs and children and providers safe, then keep 6 feet distance when you're out and about. Those are the kind of things too that also keep programs safe. And that if we want to keep childcare programs safe and children safe and providers safe, we have to protect women. And actually, we need to really be protecting women of color, because they disproportionately are the people who make up the workforce. Now, in the few studies that have existed that look at contact tracing and spread of COVID-19 in childcare programs, typically when it gets into a childcare program, it gets in through the adult. It gets in through a childcare provider, oftentimes, and the CDC documented 2 cases in Salt Lake City, oftentimes because a childcare provider came to work with a symptomatic housemate who was symptomatic and it turned out to have COVID-19, but the childcare provider came to work anyway, because childcare providers, as we all know, are not salaried workers in most cases. They are hourly workers. And in many cases, if we don't have adequate sick pay availability for them, we put them in Sophie's choice positions, of do I come to work and perhaps, bring sickness with me, or do I not come to work and perhaps not have enough resources to be able to continue putting food on the table for my own children, to be able to pay my own bills. That gives you a sense of what some of the findings were that we looked at. In terms of the framing, it's exactly what I just said. I mean, like if, if the findings had come out in the opposite direction, we would have a different set of framing concerns. But given the direction in which the findings did come out, the biggest concern that I had, in terms of counterframes that could come about, would be, that the findings would indicate to people that childcare programs are somehow magically safe, and therefore just open to the doors and just stop doing everything that we were doing to try to keep them safe and not provide any supports to these childcare providers. Or that it would be extrapolated to mean that these things are true also for K through 12 or for colleges. And we should, like one of my biggest concerns was that, once we knew the findings, that headlines would come out and say things like, Yale study proves Trump right all along, open those schools, and we were concerned about, whether or not the findings would be read in that way. And so from a framing standpoint, when you sort of think about framing inoculation, like how do you frame something in a way that inoculates it against counterframes that you're trying to avoid? I worked with Frameworks. They're a group that has done a lot of work in the early childhood space, and I've been working with them on other projects before. And usually when we do studies like this too, I want to do like proactive outreach to the media. I'll work with media rollout teams, and in this case, we work with Craft Digital Media Group, which is a very good media rollout group for studies like this that are about public good and policy implications and things. But I've worked with other media rollout groups too, and they've all been great, the ones that we've chosen. So when we thought about the frame, one of the frame considerations that came up is if you want to sort of keep the context around it, then you can't lead with the finding. You have to lead with the context. Don't lead with childcare programs appear to not contribute to the spread of COVID-19, and then bury the context, because it would be unlikely that you'll be able to get the reporter to add that context in. So we literally just reversed it around and said during the early months of the COVID pandemic, childcare providers were doing amazing, near Herculean things to keep our babies safe. And the good news is it appears to have worked. And by doing that, that doesn't necessarily mean you're going to get that as a headline, but it does mean that it's a whole lot harder for the reporter to forget that context. And so then when you're speaking to reporters, you can keep bringing them back to the contextual findings of, you can't extrapolate this to K through 12. When you're talking about K through 12, you're talking about older children, you're talking about very different conditions in which these childcare, in which K through 12 programs operate as opposed to childcare. And also that these childcare programs were doing a lot of amazing things. And if we want to be able to keep them safe, we need to, one, be able to make sure that community level transmission is low, so that the community is not threatening the childcare program and not threatening the children in the childcare program and the providers that are in that program. But also, if you want to keep childcare programs open, we need to be able to make sure that these childcare providers have the resources they need in order to continue keeping them safe, themselves and their children safe. And that means staffing and supplies and supports and things like sick pay in order to be able to not come into work when they're not sick. And then later on, as testing becomes more available, prioritizing childcare programs for testing. And when vaccinations become available, prioritizing this workforce for vaccination. Those kind of things too are the findings, or they're the implications that we wanted to be able to highlight. But you can't highlight those implications if the finding itself gets reduced down to something as simplistic as childcare programs are inherently safe. And so we need to make sure that the context was in there, so that the context would get covered, so that we could then have headlines that lead to solutions, or headlines that lead to positive things that we wanted, such as additional supports and continued supports for childcare programs in order to be able to keep them safe, and a realization that this is all really tied to the community that's around them too, and you can't forget about that. In terms of next steps, and altmetrics, let me say a little bit about altmetrics. So in my field of academia, we have something called impact factors. Impact factors are ways to measure how much your journal that you're publishing in is cited by other journals. In my opinion, it's not much of an impact factor, because basically it measures, how much is my work impacting my colleagues in the faculty meeting. And really what we wanted to do, we want to impact the bigger, broader discourse. We want to impact policymakers. We want to impact the public. Altmetrics is a company that's been around for about a decade, and what they do is they measure the impact of a study on media coverage. In other words, how many different major news outlets covered it? What's the quality of those major news outlets? What about social media feed and things like that? Just after only 2 to 3 weeks of the release of the study, and out of 16 plus million studies that Altmetrics has been following over the past decade, we are in the 99.99th percentile in terms of media coverage. And I can't really say enough about how kind of amazing that is, because this is an incredibly media saturated time. I mean, I've never seen a media saturated time like this in my entire 25 years of working with research in media and public policy. It's saturated and it's chaotic. And to be able to get like not only one, but two, I think, or maybe three stories in the New York Times, and having the Washington Post cover it, and NBC Nightly News, and on and on and on, you know, that's kind of amazing. But the other part that was amazing too was that the frame mostly held. And for the most part, most news coverage followed the frame that we set really well, and made sure that they did talk about the fact that these findings are within the context of childcare providers doing incredible things, which then set us up to have people like Nanette Braga, who's the CEO at Childcare of America, and full disclosure, I'm board president right now of that organization, for her to be able to make policy recommendations off of it. So that you have the researcher here talking about objective research, and then you have the advocate talking about what we should be able to do for these childcare programs in order to be able to help them going forward. So Altmetrics is something that we use and that we track in order to be able to see how good our coverage is, both in terms of quantity and in terms of quality. Next steps, there is a lot of data in here. And so right now we're working on studies having to do with the mental health and the mental health burden of COVID-19. We're working on studies having to do with the economic impacts of closures of COVID-19, and equity issues regarding those economic, or equity issues regarding the economics and the impacts on children of closures. 9% of the child care programs that stayed open in our sample closed at some time because of a suspected COVID-19 case or a confirmed COVID-19 case. And so what was the economic impact of that within communities? What is the likely impact on that in terms of different racial groups and ethnic groups and things like that? I'm trying to figure out whether I should talk about this one or not. There was something that was really unusual that happened in this study, and that was that when we started collecting the data, partway through the data collection, and right at the time that we were issuing our first set of reminders, George Floyd was murdered in Minnesota, and a lot of racial justice-oriented protests happened at that time. And one of the things that we're looking at now, in terms of the data, is looking at how much psychic stress was on our child care providers in terms of depression rates, because we measured that, and in terms of stress rates, because we measured that too. We have national norms to be able to see how stressed out were they at the beginning of our data collection, and how did that look across racial and ethnic groups. But then to look at that longitudinally over the course of the data collection and see at the time of George Floyd's murder and the protests, what impact might that have had on our child care providers of color? In other words, what is the burden psychically on these child care providers of worrying about COVID-19 and worrying about whether or not they might give it to their children or bring it home to their own families, and the stress of the economics of what that might mean for their own program? And then what does that mean when you add on to it, especially for our providers of color, the added burden and stress of racial unrest? You know, and so that's another thing that we're going to be looking at. We had 20-some thousand child care providers in the study that left, in many cases, incredibly extensive qualitative comments. And we have a large team of students right now who are following very specific protocols for coding those qualitative data. And we're going to be running it through some analytic programs too, in order to be able to pull out specific stories and specific threads that might come out in terms of the qualitative comments that people provided. And we're also considering various different follow-up studies in terms of looking at what was happening in the first 3 months as a baseline, and then seeing to what degree did taking this virus seriously then relate to the likelihood now of closures and the likelihood now of child care providers and children getting sick in programs. I was also asked to talk about what we could and could not control. And the first thing that popped into my mind was, one thing I can't control is the weather, but I can sure well check the forecast and decide, what to wear. We knew going into this that this is a highly politicized topic. And so it became incredibly important to us to think about how do we frame this, and then how do we inoculate that frame against the likely counterframes. And they were incredibly predictable, and they certainly happened. I mean, when we first put out the findings, Scott Atlas, the coronavirus medical science advisor, tweeted out all kinds of stuff about it that just weren't even related to the study itself. And so I had to go back onto Twitter and be able to take on Scott Atlas. But we could kind of anticipate that was going to happen. We can guard against, to some degree, inadvertent mistakes in misframing from other people, but we can't easily guard against very purposeful misframing efforts. And so that becomes the more challenging part of it. One of the things I couldn't control was this. 5 days before we released this, it was a planned release and rollout and everything, and it coincided with when the study was first disembargoed by the journal Pediatrics. 5 days before that, a different researcher, I'm not going to name any names or anything, but a different researcher put out something about a data dashboard that she had created to crowdsource information on schools and how many cases of COVID-19 are in the schools. Quite frankly, you can't really gather any important information from something like this because there's no way to know how representative it is, and there's no comparison group that you're comparing it to. And so you're just looking at a bunch of numbers and deciding whether they look high or low to you, and that's just not the basis of any particular science. But when the person released it 5 days before, they released it to a fanfare that they had created with an article in the Atlantic that had an incredibly polarizing title. And when you read deeper into the article, it was all about what blue mayors were doing and blue governors versus red, and so I knew going into this the topic would be politicized, but I was hoping that I could find a way to be able to frame this so that data could be seen as an arbitrator that's objective to the politicization. But I'll be darned if this one person didn't politicize even the concept of data collection. So we had to be much more vigilant with how we dealt with all of that. So that's everything that I had to say. I hope I didn't talk way too long, and I'm going to exit this right now and give back over the screen share and come back to you. So thank you very much.
Thank you, Walter. That was so comprehensive, and yet there's so many more things that I would want us to talk about. So
I talked too much?
No,
I hope I didn't talk too much.
You did not. So I think what we'll do is, Elliot, I'm really glad Walter put up the slide that talked about his various funders, because I know we have representatives from several of the funders on the call and in our ECFC membership, but we've asked Elliot Brenner to represent the funding point of view, and I see we have Andy Klingenstein with us as well. So Elliot, if you don't mind just telling us a little bit about your perspective in this, how it fits in with your strategy, what motivated you, whatever you want us to know about it. And if folks want to chat questions that maybe you've on your mind or that you've jotted down, I'll kind of keep a look at the chat so that after Elliot gives his reflections, we could jump right into Q&A.
Thanks, Shannon. And I'm aware that there's many people on this call who probably want to ask questions. So I don't want to get too deep into our strategy and the relationship of this study to our overall strategy. But I can just say that I think Walter did a fantastic. I've heard Walter speak about the study now several times, and I think he did a great job describing the study. And when Walter approached Andy and I about potentially funding the study, I think the reaction was, this is such an amazing study and such an opportune time to do a natural experiment. And if you just put yourself back into March and April and what we knew and didn't know, it was just a completely unknown landscape. And I think Walter was so smart about surrounding himself with experts in epidemiology, and it just, truthfully, it seemed like somewhat of a no-brainer to invest in this project. And I think it's also because, as you could tell from Walter's presentation, he's not just an academic researcher. He's thinking well in advance about the implications, potential implications of the work from a policy standpoint, and what's it going to mean in the community, and how are you going to communicate that? And I think that is something that makes Walter unique, and something that I think that we can all learn from as we think about the projects that we invest in, and the work that we do to try and move the field forward. I would love to throw one question out, if is that okay, Shannon?
Mhm.
So it's along the same lines of what I was just saying, which is, Walter, when you think about your research and how you think about policy and message framing, and really the end game of what happens to kids and families, and particularly around childcare as well, what aspects of your work do you think that foundations, or work like yours, do you think foundations might be overlooking when they try and support this kind of work? In other words, where should foundations be putting more of their eggs from your perspective?
Yeah, that's a great question. I don't want to ever be so presumptuous to tell other people what they should do, because I struggle enough with trying to figure out what I should be doing. But I do know that I think that there's a place for funding rapid research, because there are times when things just have to be known really fast. And when the process to conceptualize and to get the funding and then to actually do the work and hire people, takes too long, then it means that research can't be reactive. And it means that it almost can never be proactive to circumstances, And so trying to figure out, are there groups that could be supported to be sort of like on the ready and be able to do rapid research kind of things, especially in pandemic kinds of times. Also thinking about, how do we think about research that looks at primary questions, not in the absence of issues of equity? Because there is literally no question that we could possibly be looking at that doesn't have an equity lens that can be applied to it. Or really, I should say it a different way. There's no question that we could possibly be looking at with research that has no equity lens that should be applied to it. We should be applying equity lenses to literally everything. And if the people that you're funding aren't able to articulate the equity lens on what it is that they're looking at, but also what the implications of that would be in terms of equity, I think that's an important thing to think about. And also I realize that some funders fund services and some funders fund research. I remember, several quotes from my mentor, Ed Ziegler. And one of the quotes that he said is that, he'd rather have 3 lines in the New York Times than 3 more peer-reviewed publications. And when he was asked why that was, he said, because I want to help kids. And the people who help kids don't read peer-reviewed publications. They read the Times, they read the Washington Post, and working with researchers and helping them be able to conceptualize some kind of a plan for how their research will live in a world other than just academia. Like the work that we do in academia should not be to fill up academic journals. It should be to help people. But oftentimes people in my line of work get caught up in the realities of their own work and the rat race of it, and I think oftentimes forget that. And in many cases, it's not just that they forget it, they're totally agnostic to it, and they have no idea how to think about public media and things like that. And so maybe even thinking about, if you're funding X, Y, and Z, could you also fund a media arm that utilizes X, Y, and Z, and then uses that to be able to better convey messages and information? Or is there a way to be able to encourage people who do research to be thinking about X, Y, and Z, and having maybe within your own organization resources that they can be able to access? Those are some of the quick things that pop to mind.
Thanks, Walter.
Oh, and one other thing that I should add too, when I was offering people basically an opportunity to win $500 if they participated in an epidemiological study, we also offered them the opportunity to be able to go to a briefing that we would have that they could be able to get all the information from the study, and we would share it directly back to them within the spirit of the fact that it's not my data anyway, it's their data. You know, they just loaned it to me so that I could be able to aggregate it and lift out stories from it. You know, and maybe even trying to find ways to encourage your grantees to, especially if they're doing research, to find ways to give it back to the people who actually gave them the data in the first place. And we took that as an opportunity too to ask the field, well, you know, you got a bunch of researchers on a Zoom call with you right now. What do you want us to provide? What questions would you have us provide? And to try to find ways to either within the things you find or maybe collectively across them, encourage more community-based participatory research, where some of the ideas come from the field. Because quite frankly, many researchers, at least in my humble opinion, don't really know the most important questions that are out there. The field does, but they might not be able to find a way to articulate it for the researchers. And so there might be a way for funders to be able to bridge that gap.
I really appreciate that. And one thing that you reminded me of, back in September, we had folks present the Rapid EC study, very different study in terms of methodology, but I think that both the speed of it and also the equity lens that comes out in every single report because of the way, and also the communication, right? If you've been looking at, they've got the infographics. So I think that's very interesting. The things you cited have been some of the same things that other study, the Rapid EC study that some folks on the phone have funded. Those are themes. So I think we have some emerging themes between those. So nobody chatted a question, but you're not usually a shy group. So I think we're small enough if somebody wanted to unmute, you could just ask a question. And if not, I have one. But.
Hello, this is Marina Durano from the Open Society Foundation. Thank you very much for the research results. My grant making is focused on women's rights and really trying to understand women's time, partly the time use and the double burden that women face from both working and having children, which is even much more difficult when you're looking at early child, 0 to 3 or 0 to 5. What connections can we make between your research results and our need to also promote gender equality by giving women more time, giving back the women more time for themselves, either for leisure, for more, for work, or however they want to use time, that moving away from just purely providing care themselves. So is there anything there that we can learn from you so that we are looking both at the welfare of children, of the caregivers, and the parents?
No, that's a great question.
Yeah.
Yeah, no, I think I follow the question. I think that's a great question. I mean, it's one of the reasons why I enjoy doing work in childcare, because I mean, childcare is about women's rights from multiple perspectives. You know, and one of them is that disproportionately it's women who need childcare in order for them to be able to work and be a part of the economic structures that are out there. You know, so when childcare is down, it impacts women. A lot of women were forced out of the workplace because of the closures of childcare in schools, and so I mean that alone makes it very clear. But the other fact is that it's a female-dominated workforce itself within childcare. You know, within our study, it was like 98%, 97%, something like that, female. You know, and so, you know, you can think about childcare and its importance to women in terms of the service it provides, but also it's important to women as a major employer of women. You know, so both of those things I think are ways to sort of think about, you know, anything that happens within childcare has major implications for women. On top of that, some of the things that at least I'm working on right now is a study having to do with reproductive health and justice, and another study having to do specifically with paid parental leave. And within the paid parental leave, we've collected data across all 500 Fortune 500 companies across the United States and what their paid leave structures look like, and then comparing that to like gender equity issues on their board, gender of the CEO, um, the type of clientele that their company serves and who it is that's on their boards, and then working with an economist to try to then look at what the economic implications would be to Fortune 500 companies if we publicly funded parental leave, you know. And so trying to find ways to be able to do research in that way in order to bring business on board with something that we think would be a good thing for not only children, but also for women. One of the things that I learned a long time ago is if you care about children, you have to care about women, you know, and there's just there's no way around that, you know. And so I think part of what my answer to your question, I hope this is in response to it, is sort of thinking not only about, you know, what are the things that we can fund and do that just have a disproportionate impact for women, but also thinking about what are the things that we can do that can bring other allies into a conversation that would change policies in favor of women, such as business leaders in Fortune 500 companies.
And we have one other question, but one of the other things that the study reinforced, I think people knew, but you have findings on the proportion of this female-dominated, disproportionately women of color workforce who are coming to work in a pandemic without health insurance, who are coming to work in a pandemic with no paid leave because of the sector they work in, which is also a women's issue, right? Those things tend to cluster in jobs, right, that are disproportionately female jobs that people come to work in those conditions.
Yep,
You've got
absolutely.
data on that was in it, right? So
yes, it is. In part because we wanted it in there because it has health implications, but in part
right.
too because the economists on the team really wanted it in there. You know, we have a couple of economists on our team.
So the last question is from Claudia Vargas, and she asked, given the results of the study, what is ours to do? Meaning, like, what is philanthropy's role at this point? What would you like us to, as you know, the funders, to do, either to act on it, to extend on it? What would you want to see?
Oh, that's such a great question too. You know, I learned a long time ago that in terms of communications, whether, you know, and I guess what I'm getting ready to say might have changed a little bit in the past few years because of a clear effort to undermine the notion of science, you know, but for the most part, people tend to believe numbers, but they remember stories. And how can we fund good science that answers important questions and then find within it stories that illustrate what we've learned from the numbers, and then lift up the stories, not just the numbers in isolation. And so that's one of the reasons why we're looking at all the qualitative data that we got from these stories. But it's also a reason why I've been in close contact with a tech company that creates an app for individuals to be able to create their own documentary, and then upload that to a cloud where then we can access it and then be able to stitch it together into collective stories. And so one of the things that I'd like to do is going back into the data that we've collected with people who have already said, yes, I would like to participate in more surveys, maybe reapproaching them and saying, at least for some of them, we'd like you to participate in the story, but this time, this story will require your iPhone or your Android device. And would you be interested in telling us in your own words about what it is that you struggle with? You know, what does that look like? And then finding not the unusual, strange stories that might be completely unrelated to data, but finding the stories that really do illustrate what it is that we know are major concerns from the studies that we've been conducting. And then finding ways to be able to stitch those together in something that could actually be able to help lift up voices and be able to help remind people that these numbers have people behind them, you know, and that there's these individual childcare providers were doing something incredibly brave at the beginning of this pandemic. And the ones who came into work were doing something incredibly brave because they didn't know what was going to happen. And they were afraid. I know they were afraid because they told me so in the surveys. And the ones who didn't come into work, they were doing something really brave too, because they were worried about whether they would ever have a job to come back to, you know. And so trying to find ways to lift that up, I think, becomes a powerful way to be able to show decision makers, policymakers, but also the bosses of decision makers, which is the general public. Here's what we know from the data, and here's what we can show you from the stories.
We're at 4:01, but we had late breaking questions. Can you stay 5 more minutes, Walter, if folks
Sure.
want to get the answers to these
Sure.
questions, or have you got, okay. So Linda in Mississippi asks about significant differences in findings among regions or rural versus urban.
We haven't looked at rural versus urban yet, but that's something that we want to look at. And I would especially want to look at it if we're able to do a subsequent data collection. And the reason why is because the first 3 months of the pandemic looked very different in terms of who was hit in the next 3 months. And then in the third 3 months, I think it's going to be a lot more diffuse across all of those areas. It's a great question. As somebody who grew up in rural Kentucky, I highly resonate to that question.
Thank you.
And then Joelle Jude Fontaine up in Michigan asked if we have information about socioeconomic conditions facing the providers. You talked a little bit about the programs, so I think this also refers to the individuals as well as the impact on the programs of opening and closing.
Yeah, I wish that I did have more information on, like, for the individual childcare providers in terms of like how many sources of income do they have in their home, how much money they're making, how reliant are they upon this particular job. In many studies that I do, we collect that kind of information, but given the sheer amount of information we had to collect just to be able to get the epidemiological data, I had to cut back on something like that. But if we were to do a subsequent data wave, I don't need to collect a lot of the demographic information that we have that wouldn't change, which then would open us up to the possibility of collecting more about that, because that's a great question to be able to look at. And to not only look at the individual economic issues that they are facing, but to put that within the context of the economic issues that the community around them is facing. You know, because it's one thing to be at a certain economic level of security within your family in an area where everybody's struggling versus in other areas where it might look, where the disparities are even greater around you. You know, so we want to look at it in terms of both community level and individual impact level. And it's great to hear a question from Joelle. Joelle was, I remember Joelle from 25 years ago. She and Luba Lynch funded one of the very first studies that I ever conducted, and it was a pilot study that ultimately turned into all of the research on preschool expulsion.
Oh, wow.
So, hey, Joelle.
So, well,
hey,
thank
Walter,
you.
you're dating.
I miss you, my friend.
Well, thank you so much. I really appreciate it. I appreciate you spending the time with us. And, you know, thanks also to all the folks who funded this and made it possible. I hope everybody stays well.
Great. Thank you. Thank you all so much.
Thanks,
Have a good afternoon.
Bye. Thanks.